Hi friends, I am Sudhar sir. I am going to give you a lecture on leprosy. You know that what is leprosy? What is the disease is there? What are the main causes of this one disease is there? Then why we are going to study or we are going to give this one the importance to this one disease? What are the positive agents are there? Likewise, the informations are there that we are going to study in this one particular disease. You know that what is communicable disease. Likewise, the previous one, Mycobacterium tuberculosis. This is a communicable disease. There, leprosy is a communicable disease. You know that what is the Marathi name of this one? In Marathi, this disease there is known as a maharog or kushtrog. You know that most of the peoples are there that are hesitating to live with such type of the peoples are there, or to give the treatment to this one particular patients also, so that the whereas great persons are there that are to be involved to give the treatment to such type of the patients are there. That is Baba Amte is there, that is one of the great person is there who is going to give treatment to such type of the patient. He is not going to hesitate to give treatment to such type of the patient or the leave such type of the patient. He only think that you are going to take care and that are safe for this one. Now, these are the symptoms are there. We have to be observed in such type of the patient. Now, leprosy, the disease there is occur because of the Mycobacterium leprae. Just in TB, the Mycobacterium tuberculosis is there. The same one is there. Only the species is there. It should be different. Instead of the tuberculosis, there is a leprae is there. So just like that one, the disease is there that it should be spread. But TB there should be spread by the nasal infections or likewise. But in case of this Mycobacterium leprae, that are to be transferred by because of the direct contacts are there, by which the disease is there is to be transferred. So we are going to take precautions just to use the specific articles are there where to be utilized while handling such type of the patients, or the take precautions to avoid the use of the such article which are to be used by such type of the patient. Leprosy is firstly directly attacks on the peripheral nervous systems are there, where the legs are there, hands are there, and body organs are there that is to be affected. Later on, that disease is there that is to be enters into the affects to the different body organs are there, such as meninges are there, brain, eyes are there, then your skins are there, likewise the functions are there that should be affected. Here we see that the fingers are there, that are affected, the hands are there that are affected. Here we see that the in the photograph, the lady is there that is having no fingers are there that is to be suffered by the leprosy. This one lady also, the fingers are there that are cut because of the leprosy. The contaminations are there that issue occur, and severity the issue occur. So sometimes such type of the precautions are there that should be needed to cut this one fingers also. Now this one person is there is also suffered by this one leprosy on the face. The leprosy, Mycobacterium leprae, there should be attacking, and such type of the conditions are there that appear. Now this one lady there is also on this one lady, no on this one nasal secretion, the mucous membranes are there, this Mycobacterium leprae there should be attacking. So such type of the conditions are there that is appear. This one lady here, the fingers are there that are mostly infected by this one Mycobacterium leprae. Mycobacterium leprosy that causes a disease is known as a leprosy, and a scientist who search this one disease or the symptoms are there, that is nothing but is a Hansen. In 1837, he searched this one disease and saw that the disease there is also known as a Hansen's disease. And leprosy, in this one particular word, lepi is the one is there that is Shioka, that is nothing but is a scale of the fish are there on the fish body. There is a scales are there that are to be present. just like the scale like structures are there that is we found on the surface of the hand, so that it is also known as the scale of the fish is there, or this disease is there is also known as a Hansen's disease. To protect or to give the treatment to such type of the patient, our government have decided to give the treatment. So for this one we are going to consider the different days in a whole year, so that likewise a leprosy day is there that is we arrange on this one day. We are going to give the treatment and to take care or to recall such type of the patients are there, that is nothing but is your world leprosy day, that is nothing but is on the 13th January. The day is there that is we have to be consider for this one particular patients are there. Now, I told you that that disease is there that is discovered by Gerhard Amrau Hassans in 1837. He searched this one sign and symptoms and the positive agent. So, by this name, the disease there is known as a Hansen's disease is there. Okay. Now, this one disease is there that is a chronic infectious disease is there. Leprosy, or we can say that Hansen's disease is a chronic systematic infectious disease. Primarily, it's affecting on the peripheral nervous system or the peripheral nerves. After that, is going to affect on the skin, mucous membrane, then eyes, then bones are there, then lymph node, viscera. Likewise, the organs are there that is affected. In case of the peripheral nerve, mostly your hands, legs are there that are to be affected, or the skin is there is also affected in this one case. Okay. Now, the as I told you that this disease is there, that is a leprosy, is mostly occurred by the Mycobacterium leprae is there. In short, it is also known as a MI. The Mycobacterium leprae cannot grow on the culture media, just like the various type of the organisms are there that are to be grows on the culture media. But this Mycobacterium leprae are there that are not to be grown on this one culture media in the your pathology lab. In vitro drug sensitivity there is not possible, means which type of the drugs are there that are sensitive to kill this one. It's quite difficult to search this one. The growth and the drug susceptibility are done by injecting the inoculate into the mouse foot pad, means initially you have to induce some of the drug, and then you have to induce the Mycobacterium leprae. Initially the on the rat the experiments are there that are to be performed, and once the protections are there that you have to be observed, then such type of the treatments are there that are to be given, because on in the pathology lab you can cultivate this one Mycobacterium leprae and to search the drug which are to be used in this treatment of the Mycobacterium leprae. So in vivo studies are there that is the only possible. No in vitro studies are there that is possible. Initially, whenever this one Mycobacterium leprae is enters into your body, they are live in a dormant condition in the macrophages, but alive one. That will be transmitted from one person to the another person through nose is there, then skin lesions are there, then infected persons are there that affect mainly the your peripheral nervous system is there, the nasal secretions are there, then skin and the various tissues are there that are to be affected by this one. Okay, means initially when they are to be enters into your body, it does not show direct effect. They have to develop in our body. They are in a dormant condition, and later on they have to be developed, and then they are going to show their symptoms is there. These are your Mycobacterium leprae, having a total length is there is about 5 micrometer is there, and the diameter is there is near about 0.2 to 0.4 micrometer is there. Now the bacteria resides in cooler part of the body. In your body, they are live, or they are mostly found at the cooler surface on the body, where the locations are there just behind your uh, back is there. At this one scalpels are there at that one particular location. These are there that are found. Then they are also present in the your central nervous system, such as your meninges are there in the brain. They are to be found. Then your spinal cords are there. Then peripheral nervous system are there. Then peripheral nerves are there. At that one particular location, they are mostly uh, present. These are the most location area there where these are to be found. Then how this one show their infection, or we can say that the mode of action. The leprosy is the slowly communicable disease. There means when they are to be entered, you can't think that when they are to be enters into your body. After the incubation period, once this disease enters into your body, or Mycobacterium leprae, or we can say that leprosy disease enter into your body, the incubation period is between the first exposure when in this case, we see that disease there is to be occur. uh, Appearance of the sign and symptoms are there. This is the first one is there, means either they are taught to be entered through the nasal secretions or by any means that are to be enters into your body. Second one is there, that is a direct contact, the prolonged close contact of the susceptible individual to an open case of the leprosy. For example, any one person is there that should suffer by this one leprosy, and he suffer by or the accidentally some of the injury there should be occurs, and you are going to help to this one patient, and he came in direct contact with you. The damaged skin is there, or the nasal secretions are there, or the mucous membrane contacts are there that should occur, then this is a direct contact is there is to be found. Then materno-fetal transmission is there, that is this is there should be also transfer from the mother to its infant is there, that is transferred through the milk also. This is transfer is there, but it's very rare is there. The transmission rate is there is very less. That is a maternal fetal transmission. Now the next one is there. That is, these are the transmissions are there. This is the nasal drops or the oral droplets are there that are to be transferred through this one, either direct or indirect contact. The disease is there should be transferred. Second one is there, that is a dermal inoculations is the second one method is there. By the injections also the disease is there is to be transfer. Okay. Now the next one is there, that is a armadillo. This is the one animal is there which is mostly responsible to cause this one leprosy, because this one bacteria which are to be present on this one, these bacteria are there that are mostly responsible to cause leprosy. They are transmit the leprosy. They are act as a animal model along with the monkey, mice, and rabbits. If some of the monkeys and mice are there or the rabbits are there, they have to become in contact with this one armadillo, then there may be the chances of this one transfer of disease is there, because the mycobacterium leprae, they are to be bacteria are there, they are mostly present on this one armadillo, and by which the disease is there is to be transferred. Okay. Then incidents are there, then high risks are of those living in endemic area, mean those people who are living in a hot zone along with the moist humid climate, mostly in the surrounding area of the sea surface are there. uh, in that one particular area the climate is there is to be hot, and because of the uh, water, sea water, the climate is there that is to be humid. So in that case, there is a very well chances for the development of this one disease there, along with the poor conditions such as inadequate bedding are there, means beds are there that is not to be followed properly. Then contaminated water is there, then insufficient diet is there, then other disease that can compromise the immune functions. Means just like that some of the diseases are there that are present in your body, mostly the HIV is there, in which there is a human immunodeficiency, is there, deficiency or immune power is there, it should be lacking. In that case, the occurrence of this disease is there is more. According to the World Health Organization, India, Brazil, Indonesia, Myanmar, and Nigeria are with the most cases are there where the occurrence of the disease is there is high, because in this one particular country, the they have a hotter climatic conditions along with the moisture if there is to be present, so the occurrence of this one disease is there is high in this one particular countries. Now this disease is mostly primarily is classified into the two types. That is a tuberculoid type, that is a high resistance, and second one is there, that is a lepromatous or lower resistance is there. And if some of the sign and symptoms are there that is not to be appear, then that class is there is nothing but the, that is a class not falling in this one are considered as a borderline leprosy. Means this leprosy is classified into the tubercular type of the leprosy, then lepromatous leprosy and borderline leprosy. These are the three parts are there by which the leprosy is there is mostly classified. Now we see one by one what is that one. The classification is also based on this one, that is based on the clinical, then bacteriological, then immunological, then histopathological features are there. Some of the uh, classification is actually based on the bacteriological, means the bacteria which are to be present depends on the leprosy is classified. Sometimes the immunology, then histopathology, what are the changes are there which are to be observed depends on that, the leprosy there should be classified. First one we see that that is a Pauci uh, Pauci bacillary. The example is there, that is a tuberculoid leprosy. It is known as that, in short, it is known as a TL, that is a tuberculoid leprosy. With the scanty or absent bacilli, I mean the bacilli are absent in this one particular case. This is mostly found on the skin lesions where there is a loss of the sensations are there. Means once this one disease is there that is we appear, there is a no sensation are there that is we appear. Here to be see this one particular area is there where the bacteria are there that are not present, but the lesions are there that is we observe. And on this one there is a no sensations are there that are to be observed. This is known as the uh, bacillary is there. Okay. Now the next one is there, that is a multi-bacillary. We call it as a borderline with the numerous bacilli. I mean the bacilli are there that are to be present on this one. Numerous skin lesions are there. These are the lesions are there which are to be observed in this one particular surface, or somewhat the patches are there that we are to be observed in this one, and there the loss of the sensation is there. Then the third one is there, that is a multi-bacillary, that is a lepromatous leprosy is there. Is multi bacillary lepromatous leprosy. The nodules and the plaque are there that should be observed. Then the skin is become thickened. Then there means loss of the sensations are there that are to be observed. Then neuronal damage, means nerve damage is there that should be observed. Along with no sensation, the patches are there that should be observed. Then nasal congestions are there. Then epistaxis is there that should be observed in such type of the disease is there, that is a multibacillary lepromatous leprosy is there. Now the symptoms are there, that is a leprosy attack. Firstly, a leprosy attack on the nervous system, particularly the nerves of the hands, then feet and the face are there on this one particular location. This shows their attacks mostly on the skin also, it shows its attack, but before that the hands as well as the feet and the faces are there that are to be affected by this, where particularly the first symptoms are there that should be appear. In tuberculoid leprosy, skin lesions typically develop in the area of the nerve damage. The skin becomes pale at that one particular level where there's a effect. It shows its effect. The skin becomes pale and may develop a radish or a copper color is there that is we develop at that one particular area. Then lepromatous leprosy, the loss of the sensation, means at that one particular layer, area where the lepromatous leprosy is affects on your skin, there is no skin sensations are there. If you have to pin this one particular area or prick this one particular area or lightly touch to this one particular area, there is no any type of the sensations are there that are to be observed. The starts at the finger, means the development of this leprosy there should be started from the fingers just below the tip of the finger are there, from which the effects are there that it should transfer. Then toes, fingers and the toes are there that should be affected. Then affect a small patch of the skin and begin to with and it begins with this one, but as the time passes, many skin lesions and the nodules are there develop, that is the organ deformities are there. Means initially at the fingertips they show their effects, but if we are not going to take the treatment, the development is there is to be continue and slightly is going to capture on the skin, then slightly on the organs also. Means one slowly in that is we develop. Okay. Tuberculoid leprosy, the bacilli are usually absent in a slit skin smears. If you are going to take a taste of this one slit in tears, the bacilli are there that are to be absent. The histopathology shows tuberculoid granulomas that are composed of epithelioid cells that are to be surrounded by a zone of the lymphocytes are there. That is a lepromine test is strongly positive. If you have to consider this one for this one tuberculoid leprosy, the lepromin test is there that is to be used for this one, where the bacilli are there that are usually absent in this slit skin smears test is there, but the lepromin test is there should be strongly positive. Okay. Now the next one is there. These are the figures are there that shows that there is a development of this one tuberculoid leprosy is there. In this one on the your stomach or the back portion, the patches are there that are to be observed, where there is a somewhat granular structure is there should be observed. Then this one patch is there should be observed, which is should be widened. Then on the hands also such type of the patch is there should be observed. Okay. On your cheeks, such type of the patches are there that should be observed, that indicate that the patient is there should be suffer by the leprosy, tuberculoid leprosy. Now the lepromatous, second one is there, that is a lepromatous leprosy. The cutaneous lesions. It consists of the macules or papules, then infiltration or the nodule, that is a lepromas. So that it is known as a lepromatous. A type of the leprosy which is occur because of the lepromatous. They are the numerous bacterial symmetrical ill-defined with the shiny surface. Sometimes you have to be observed that the some of the shiny surface with there is a no patches or no sensations are there that are to be observed. That is nothing but lepromatous leprosy is there. The surface commonly affected are the face surface are there, then arms, then leg, then buttocks, but maybe anywhere. These are the most common areas are there where the occurrence of this one disease is there is to be found, but it is not like that only on this one surface. The disease is occur. It can be found on anywhere on the your body. Okay, lepromatous leprosy. These are the lepromatous leprosies are there. You have to be observed that so on the face, the nodules are there that you observe on the your back. This one type are there that are to be observed. Somewhere there is just like the watery pores are there that is to be observed, or bubbles are there that are to be observed on your body also, this face, your back. Likewise, the different images are there to show you that indicate that patient is there should be suffer by the lepromatous leprosy. Now the diagnosis, how we are going to diagnose this one. The clinical symptoms of the diagnosis are there, that is anesthesia, then nerve enlargement, and the characteristic skin lesions are there. Means on the skin, some of the lesions are there or the nodules are there that are to be observed. which are a somewhat different one as compared to the other. Then slit skin smear, that is J. Nielsen staining of the skin. J. Nielsen stain, you well known about this one, and you have to heard this one name also many times. J. Nielsen stain is there that is we utilize for the diagnosis of this one. Then skin biopsy, means some of the portion of the skin area that should be removed, and that is we tissue from the skin area should be removed, and that is we utilize for the testing, that is a skin biopsy. Then nerve biopsy, the neurological or some of the nerves are there that should be removed, uh, and that are to be tested for this one, that is a nerve biopsy. Then lepromine test, that we have to be observed this just like before. This one lepromine test is there which are to be utilized for this one diagnosis is there, where the bacilli are that we have to be observed, then surrounded by the zones of the lymphoid. Then ethyloid cells are there, some of the ethyloid cells are there that you have to be observed around the granulomas, and by a zone of the lymphocytes is there, that is a lepromine test is there, that is a positive one, that is we utilize for this one. Now the next one is there, that is the clinical symptoms of the diagnosis is there. You have to be observed this one, the patches are there that are to be observed on the just behind the ears also, and on the face also, just in between the portion of the eyes to ear, the patches are there that you observe. Then on the backs of this one, the greater patch is there that should be observed, that is nothing but your clinical symptoms of the leprosy is there, that is one of the diagnosis is there that indicate that patient is suffered by the leprosy. Now the skin smear test is there. In this case, the J. Nielsen test is there that should be utilized. J. Nielsen carbon fusion is stain is there that should be utilized, where the bacteria which are to be absent in a smear are a bacillary is there. Bacillary bacteria are there which are to be absent in this one, but it shows the presence of the multi-bacillary on a smear, and that is be indicated by a blue color, that is a J. Nielsen stain is there, which is somewhat blue color is there, and that is be shows the presence of this one bacteria on the smear. Now lepromine test is there. It is an immunological test is there that indicative of the host resistance to the Mycobacterium leprae. Means if some there should be present, then there is a resistance is there is developed, and because of that some of the reaction and the sign and symptoms are there that should be appear. A sample of the inactivated, that is unable to cause the infection, just like we are going to have some of the vaccinations are there. In vaccination we are going to kill that one particular microorganism, and then we have to induce this one kill body of the microorganism. Because of the killing, that microorganism is there is unable to cause any type of the infection, but our body is going to study on this one and going to prepare some of the antibodies in our body, and that have to remain in our body. So when it is infectious agent there is to be attacking on our body, the our body is not going to be affected by such type of the disease is there. So such type of the agents are there that should be injected, or we can say that the sample of the same one, that is a Mycobacterium leprae, the that is we kill, and that is enters into your body, which is not going to cause any infection. The leprosy causing bacteria is injected just under the skin, not into the muscular or intravenous, just below the skin, intradermally. The injections are there that are to be given mostly in the forearm region. The same one is there in the TB also. Such type of the testings are there that are to be carried out. Then tuberculoid, the immune system recognize and produces allergic reaction. If that are to be induced into our body, just on the forearm, just below the dermis, and allow it to keep for some days. Because of that, if such type of the antibody antigens are there that are to be injected into our body, our body is going to perform some of the study, and in response to that, our body is going to synthesize some of this one, and if there is some of the allergic reaction, if there should be occur, that indicate that you are suffer by this one leprosy test. If there is no any allergic reaction, if there is we observe, that indicate that the leprosy if there is not to be present, or any positive agent which causing the leprosy, that is not to be present in your body. That is that immune system does not recognize this one. Now the mechanism of the nerve damage is there, that the firstly the entry through the blood vessel, means the causative agent is there that should be enters through this one blood vessels into your body, and in after that one it remain in a dormant condition. After that there is some as any one particle that is enters into our body defense mechanism tries to kill that one agent, or we can say that antigen, and tries to remove toward your body. In response to this one, various type of the reactions are appear. Inflammation is one of the important reaction in that one is there. So once the lepromatous leprosy is enters into your body, and the inflammatory response is there is to be appears to this one, and later on there is a mutations are there that is appears, or the dormant stage is there, that one mycobacterium leprae there should be present. After that one they try to kill the your nervous system. Firstly there is a demyelination is there is to be carried out, and after that the development is there is to be occur. Here we see that the scroll cell, the sheath around the axon is there is to be found. The neuronal muscular junctions are there that you have to be observed here. Okay, this is the mechanisms are there, outcomes of the nerve damage. There is a here to be observed that the sensory loss is there. Once the mycobacterium leprae enters into your body, there is a primarily is to be affected, is affected on your body, and then peripheral nervous system, that is your hand, legs, all these are there that is to be affected. Later on, you're going to affect on the skin, but initially that is going to affect on your hands. Mostly the fingers are there that should be affected, and the fingers are there that are to be bent. Here there is swelling is there is should be observed, and after that one the fingers are there that are not able to work, and after that the fingers are unable to perform. Sometimes the paralysis or the deformities are there that should be observed in this one finger. Sometimes the fingers may get cut because of the various type of the infections are there that should be observed in this one particular disease is there. Okay, now the classification, the drug which are to be used in this one treatments are there that is somewhat similar to this one is there, that is in TB. There is a use of isoniazid and rifampicin is there, but in this one dapsone here to be observed this one, that is a sulfones or the sulfide groups are there that are to be present, which are the weak bactericidal, means we are going to kill the bacteria. These agents are there that are to be used, that is a sulfone, that is a dapsone. MDT you have to be observed this one, that is a MDT. The most of the time the government advertisements are there that are to be found on the televisions, and in that case the MDT is the drug of the choice is there. That MDP it contain dapsone, then clofazimine is there, then rifampicin, drug of the choice is there, along with this one antibiotic, ofloxacin, clarithromycin, then many uh, minocyclines. Likewise, the drugs are there that are to be utilized for this one treatment, and it should remain for the several years. I told you initially that in 1995, World Health Organization distribute MDT. What that contain MDT? That is your dapsone, clofazimine, and rifampicin. This is the drug of the choice which is we use for this one leprosy, and our government is decided to give this one drug to this one free of cost all over the world to the patient who are to be suffer by this one leprosy, because the cost of this one drug is there is too much high, and such type of the poor patients are there that are not able to purchase this one. So by government hospitals, the drug free of choice that is to be distributed to the patients so they can take easily. And for this one we are going to celebrate this one World Leprosy Day and on the January 30 in remembrance of the leprosy is there. Thank you, thank you, thank you.